Jan, what a pleasure to be here with you in Vancouver today. I'm so looking forward to our conversation.
Well, thank you very much, Jillian, and welcome to Vancouver. You've chosen a lovely but rather warm day to be doing this work here in Vancouver.
Well, we're going to try not to melt in the next 30 minutes as we find out a little bit about you. So we're going to start in kind of a different way than we often do with these conversations. Often we go linear and we talk about the trajectory of your career. But today I want to start with a particular moment that you shared with me a little while ago. I want to start with you as a sister in a hospital room with your beloved sibling and taking us back to that moment in your life.
My sister, who was 4 years older than me, was struck with almost a complete kidney failure, and it had to do with a post-streptococcus glomerulonephritis. And she was on dialysis at Wellesley Hospital in Toronto for a number of years. Often in the summers, we'd go down from our house in Northern Ontario and spend the summers with her, and I was often at the hospital with her. And there was one day where we were in the hospital room together, she and I, and the doctors came around to do rounds. It was her nephrologist with a gaggle of students. Mm-hmm. I imagine now, in retrospect, I imagine there were some medical students and some residents in the gaggle, but there were 7 or 8 of those people. So they came into the room and they didn't address us. They stood there and he said, "What do you think her diagnosis is?" Didn't say hi to either her or I. And then the students sort of barked out their answers, and then they, in front of us, discussed the prognosis for her as well, which was quite dismal. And then they left, and I was shocked and saddened by the whole encounter. My sister, Heather, said to me, "You would be a better doctor than any of those people." And I thought about it, and I thought, what we need in medicine is not brilliant people. What we need in medicine is human people. That medicine has to take a whole different turn if we're going to really make it therapeutic for people. We need to be as human as we can possibly be if we're going to be healers. And that healing is so much more than just addressing the symptoms of an illness. It really has to do with looking at the whole person, appreciating who they are, hearing their stories, and learning what's in their hearts. That's the only way that we'll ever be strictly therapeutic healers.
We're going to come back to what you just said about stories and the importance of integrating those personal stories into our lives and our clinical identities. But remember, I said we weren't going to go linear. So now we're going to shift, talking about the arc of your career and your personal life to the present day. And I want to talk in particular about your life as a caregiver.
Yeah, well, you know, it's interesting. When I think about that, when I think about my whole career and going through medical school and being so keen to be a consultant, I'm a consultant obstetrician-gynecologist, as you know, and living that whole career, delivering thousands of babies and then going through a number of different career steps and having administrative and leadership positions and then getting to the point where I'm sort of trying to retire and now making the transition again to being a full-time caregiver for my husband who has advanced Parkinson's. And it's been really interesting to think about it in terms of how we identify as physicians and what it means to let go of some of that identity in favor of whatever's happening in our human lives.
Can you talk a little bit more about that? What that experience has been like for you, or what your observations have been about what's most difficult about making that shift?
Until 2017, I was actually president of BC Women's Hospital here in Vancouver, a large hospital, really responsible for much of the maternity care in the province. And when I said something, people listened. when I had an idea that I wanted to get done, I mean, it didn't always happen, but at least, you know, there was a sense that people wanted to hear what I had to say, and that I had a public presence, and that I was very much part of the conversation. So over the course of my career, if there's anything that's really motivated me, it's wanting to be part of the conversation about how to make things better for patients and for physicians and for the world. And I felt in my role as president of BC Women's that I was always part of the conversation. I was always at the table. that I had an opinion that people wanted to hear. And it's funny when you walk away from your public persona, that I would say is one of the things that I missed the most. And in many ways, I actually felt really quite saddened by it at first. I've come to terms with it now, and I realize that what I'm doing is actually probably more important than what I was doing there in some ways. One of the things that was really helpful was a conversation with my sister, who's a business leader in Ontario. And she said to me, "You're suffering from PIP syndrome," previously important person syndrome. And we both had a good laugh about it. But it is true that as we leave our roles, whether it's as a physician in active practice or whether it's a leadership role, whatever it is, we are so attached to the roles we hold, especially as physicians, but especially as physician leaders, that it can be difficult to walk away from that and become a general member of the public where you can walk down the street and people don't stop to talk to you all the time.
We talked about that transition for you, some of the emotional layers of the experience, and you've touched on some of them just now as well. But I know one of the things you shared with me is that you are a professional walker. Maybe
Yes.
professional is not the term that you would use, but you took a trip recently that had a huge impact on you and allowed you to sit differently with some of the reflections that you just shared. Tell me a bit about that.
Yeah, thank you. So I just had an absolutely fantastic experience this year. I walked the Camino de Santiago, the Compostela, and I finished an 800-kilometer hike. I did 500 this year, 300 last year. And it was life-changing in terms of dealing with exactly what we've just been talking about dealing with transitions. And I guess if I was going to try to summarize the lessons, I'd put it like this. We need time to think, and we need time to walk and be physical in our bodies. And when we are physical in our bodies, that's something we can do like walking or whatever you love to do, biking or whatever it is. We live in our bodies differently. The other thing that I found so precious about it was I don't remember a time where I had 6 hours in a day to do something that I really wanted to do, and 6 hours a day to just think. And that was just magical. And one of the other things that happened was that you're always meeting strangers, but you're meeting these strangers that are doing exactly the same thing that you are. They're on exactly the same tangent. And they're experiencing the same thing. They're experiencing the tough uphills, the tough downhills, the slogging through the 30K days. And so you start off having a conversation with somebody who may be a complete stranger, but you feel this bond to them because they've made the same decision, they've made the same commitment. So often I found myself having conversations with people that were deeply, deeply personal or spiritual that I wouldn't have at home. And when I really thought about why that was different or why I thought it was more meaningful than a conversation I'd have in the hallway of the hospital, part of it was this. When you talk to a stranger, you have to coalesce your story in a way that you can tell it in a few minutes that makes sense. So in other words, you sort of have to become a third person to your own story. And how you tell that narrative is really critical to developing that rapport. And so finding the language around some of the stuff that I'd been going through, especially with these transitions, and then delivering it in a short conversation, I found that I learned so much more about how to really put that language together. It also made me think about how important narrative is to us. I mean, everybody's story is so interesting. There is no such thing as a person with a boring story. Seriously. You just have to find what's so interesting about the stories. And I found myself able to do that and having a fantastic time doing that on the Camino.
Jan, there's so many things that you just said that I love. And one thing I find myself thinking about is something that a friend and colleague of mine, Ron Epstein, likes to say. And his framing is that there are two stories that we can tell about any life, including our own. And we can tell the version of our lives as a series of stories about things we failed at, or we can tell it as a series of things that we overcame. And you make me think about the fact that in medicine, so often, because of our personality characteristics and the things that draw us to medicine that can easily become maladaptive over time, we're very comfortable with stories about failures and why we're not good enough and how we need to flagellate ourselves to be better. So that positioning, how we tell the story when lifted out of the context of medicine and medical practice is something that I think I hear you articulating in terms of that experience on the Camino.
I think you're absolutely right about that. I think really it is so important that we as physicians lift ourselves out of our physician roles in many different ways, whether it's exercise, whether it's art, whether it's music, whatever it is, that we have interests outside so that we can actually take that step back and look at who we are in the context of our lives, not just in the context of our practice. I think it makes us better physicians. And it, in many ways, it enriches our lives as well. But the question about the failures versus challenges is a very, very good one. And I have been so guilty, as so many people in medicine, especially women. Despite how, I'd say I have had a fairly successful career, but I still find myself doing the imposter syndrome thing. I still feel myself saying, why would they want me to do that? I'm not that interesting, or why would I'm not that smart, or whatever. I find myself still doing that, where I take myself out of it, or flagellate myself from not being a little bit better than I was, or I only got 99% on my exam. Why didn't I get 100? And that's the kind of thing I think we do. And I think there's reasons that we grew up looking at that. We wanted to be perfect. We certainly didn't want to make mistakes. I mean, as an obstetrician-gynecologist, we've worked so hard within our profession to make sure that we safety-proof everything we do. And the idea that, that a negative outcome is going to arise is something that we really want to avoid. So yes, we do. We want to be perfect. We don't want to see our cracks. We want to inspire confidence. And that's always the dichotomy that we hold in our mind. We want to be human, we want to learn from our mistakes, but we want to appear to be confident and competent in everything we do. And so it's interesting. I mean, it's hard to hold in your heart the idea of vulnerability and complete confidence at the same time. And it's something that I think we struggle with as people and as with physicians as well.
Absolutely. I think it's also this, idea that often we talk about in the context of mindfulness or other sort of self-regulation practices, that two things can be true at once. We can be powerful and we can be vulnerable, and those things are not mutually exclusive, as you say.
Yeah.
There's another thing you said that really struck me, and it's about physicality and inhabiting our bodies, because I think this is something that we have to push through so much physical discomfort during the course of our training and later off in our careers in order to be successful and also just do the things that we're expected to do. And one of the things you talk about, inhabiting the body to walk or just be present with the body. I always find it so curious how so many physicians that I know who are very physically active, they're not just physically active. It's again that sort of highly competitive. You can't just run, you got to do the Ironman. You've got to do 30K. It can't be 10K, And I wonder if you could talk about your thoughts in terms of the relationship to just being and inhabiting, as opposed to physical exercise or any kind of activity that we do with the body, falling again into some of those maladaptive patterns.
Digressing just for a second, one of the things I did during the pandemic was I joined a meditation group. And from 6:30 to 7 o'clock every morning, we met on Zoom. And a number of us had worked together previously as colleagues, and it was run by one of the nurses that I used to work at the hospital. And every morning we had this fantastic group meditation. One of the things I found myself struggling with the most was that dichotomy between being and doing, which is exactly what you're talking about. We are taught that we have to fill our days. We're taught that our days are wasted if we sit around, doing Sudokus, or if we even sit around meditating. We have this sense that we're wasting time, and time is valuable. And therefore, we're bad people if we waste time, because we're wasting this precious resource. And I think that's part of it, that we grow up, or we mature in this profession where every second counts. Yes. Certainly true in my profession, that literally a second could make the difference between life and death. And that you have to be always at the top of your game, trying as hard as you can. Yeah. If not, then you've wasted your day. Yes. That really is something that I think you can't live your whole career in that and not have it affect your psyche. Yeah. So I think we really should think about the arc of our careers. And so often we're at any point in time, we're so concentrating on the one little part of our career that we're on. But I think really, if you think of the whole thing as an arc, then you get to the point where you really see how the whole thing fits into the totality of your life. If you want the sort of the angst of your life and everything else. So in the beginning, you're building up your career, and you're busy, and you're doing everything you want to do, and you're establishing credibility as a physician, and you're learning how to be a physician. But during that time, you can't stop knowing how to be a human. Mm. Because underneath it all, your humanity is, first of all, it's going to feed your medical career. But secondly, it's going to prepare you for the rest of your arc. And that middle part where you're practicing and you're learning more and more, not the technical stuff of medicine, but the human part of medicine. And then as you go into retirement and beyond, we become the mentors, we become the elders, we become the knowledge keepers in a way that our society does not really acknowledge, as well as our First Nations compatriots and colleagues. Yes. But there is something in that part of your life that is so precious. Yes. And really what I'm looking for more than anything else at this point is the opportunities to be a mentor, to be a guide, to pass on what I know, not about the technical stuff, because it changes every day, but about the human part of medicine. And so I'm really actually looking forward to the next few years and having some time to think and having some time to really be a human being apart from my physician identity.
So much of what I hear in what you're saying, Jan, has to do with consolidating these sort of fractured pieces of ourselves that have been cleaved from us for so many of the reasons that we've talked about in terms of our professional culture and all kinds of other forces that shape us. And so I want to end our time together with the same story that we started with, but with your sharing of that story and a moment that you relayed to me that was incredibly powerful. Could you tell me about a talk that you gave where you spoke about your sister Heather?
3 or 4 years ago, I was the keynote speaker for my department at the University of British Columbia Department of Obstetrics-Gynecologist. We have a yearly dinner, and I was the dinner speaker that year. And I made it a very personal speech. And interestingly, I realized that I had never told the story to my colleagues about my sister. That most people didn't even realize that I had an older sister who had died at the age of 23. And I hesitated to put that story in because we have to be strong. We can't be vulnerable. We have to be seen as being these bastions of, of competency. And yet it seemed to me it was the right thing to do. So I told the story, and I told it very much in the way that I told it today. I talked a little bit more about her and exactly what she was like. And I ended the talk to a standing ovation. Mm. And the number of people that came up to me, people who I'd known for 30 years, who had never, they had no idea that this was my history. The number of people that came up to me and said, thank you so much for sharing this. And some of them said things that I didn't know, like, I had a sister that died when she was 18. I had a brother that died. I had, I had a stillbirth. The number of people who shared their personal stories with me after I shared that story was astounding to me.
Yeah.
I mean, I know the literature on that.
Yeah.
If you actually share a personal story,
Yeah.
you enable other people
Yes.
to share their stories.
Yes.
So I guess what I'd end up by saying is that we have to share our stories.
Mm-hmm.
We have to listen to other people's stories. And in that storytelling is really the depth of our humanity.
Yeah. And I think when we share those stories, as you articulate, what we often, we worry about reaction, and instead we think of the wrong what if people react negatively, but
Yes,
what if this is what we can do that will actually change our culture?
Exactly. So it goes back almost to what you were saying. We expect a negative reaction instead of expecting a positive reaction. But what if we do expect that positive reaction and we get it? Then, and what's the worst that's going to happen?
Yeah.
People won't like my talk. It's not like it's going to be a disaster. But
No one will be harmed.
Nobody will be
But
harmed.
maybe it's the first step to changing the world that we live in.
Exactly. So it's all about really experiencing the whole depth of our humanity and using it to nurture those around us and the world.
Jan, what an absolute delight to talk to you today. Thank you for sharing your story and for sharing your wisdom and for being exactly who you are.
Thank you.